Okay, let's dive right into this. Welcome to today's Explainer, where we're taking a really fascinating look at an everyday pharmacy staple and, well, completely flipping the script on how we manage it. We're talking about cetirizine. Now, as retail healthcare professionals, you already know this molecule inside and out. It is an absolute powerhouse for allergy relief. But look, we're not just going to sit here and talk about histamine receptors today. We are looking at how to actively optimize patient care while simultaneously driving your pharmacy's revenue. We're talking about taking a very specific, very common clinical hurdle and turning it straight into a clear retail win.
So there's this paradox at the pharmacy counter that you've probably seen a million times. They came for allergies, they left with better sleep or exhaustion. It's kind of wild, isn't it? But it's an incredibly common reality. A patient walks in, right? They're just looking for some relief from a runny nose and itchy eyes, and suddenly they're trading one problem for a totally different one. I mean, sure, they can breathe again, but they can barely keep their eyes open at their desk by 2 o'clock in the afternoon. This unexpected side effect of what is really a routine treatment is exactly where our opportunity lies, for sure, both from a clinical perspective and a commercial one.
To truly grasp this opportunity, we got to ground ourselves in the clinical reality for just a second. Cetirizine is, as you know, classified as a second-generation antihistamine. By design, these newer drugs are supposed to be non-drowsy, especially when you line them up against their first-generation predecessors like diphenhydramine. They are engineered to specifically target peripheral histamine H1 receptors and basically stay entirely out of the central nervous system. But, well, as we see in daily practice, human biology doesn't always read the pharmacology textbook. It can, and it definitely does, inadvertently cause sedation. And here is the exact number that changes the whole game for us. 10%. In roughly 10% of your patients taking cetirizine, this drug actually successfully crosses the blood-brain barrier. Now, the BBB is supposed to be the bouncer that keeps these molecules out of the brain to prevent that exact drowsiness we're talking about. But for 1 in 10 people, that bouncer just lets cetirizine slip right on through, and that triggers unintended central nervous system sedation. Now, 10% might sound kind of small on paper, but think about your daily volume during peak allergy season. That is a massive absolute number of patients walking around your community just feeling completely sluggish.
The real-world fallout from that 10% stat isn't just some minor inconvenience. We're looking at really significant daytime drowsiness. We're looking at reduced concentration, which heavily impacts their work, their driving, basically their whole daily lives. But honestly, that third consequence, that is the most dangerous one for our practice. Patients switching off without even telling you. They just ghost you. They silently abandon their therapy, their allergies flare right back up, and you totally lose visibility into their care. And yeah, not to mention the lost recurring prescription or over-the-counter sale. They just suffer in silence, assuming all allergy meds are going to make them tired.
So, this brings us to a really vital crossroads here. How do we actually pivot this clinical complaint into an intervention? When a patient casually mentions they're feeling a bit foggy, or when you proactively ask them how their new allergy med is working out and they admit they're just totally exhausted, how do we react? We can't just nod and say, oh yeah, that happens. No way. We have to use this moment. We need to shift the momentum right then and there from a frustrating pharmacological problem to a highly actionable, patient-centric solution.
So the crucial point is really understanding the landscape of alternatives so you can make a sharp, immediate recommendation. We're weighing the higher sedating effect of cetirizine against the lower central nervous system penetration of alternatives like loratadine and fexofenadine. These molecules have a much harder time crossing that blood-brain barrier bouncer we just talked about. By knowing exactly which levers to pull in the moment, you instantly become the hero, the problem solver for that patient. You are literally rescuing their day from the brain fog.
Let's move to and see how this builds into our broader retail strategy. We've identified the clinical issue, but remember, we operate in a retail healthcare environment. And you know what? Good clinical care and good business are not mutually exclusive. Actually, scratch that. They actively fuel each other. We are looking at smart cross-selling opportunities. When you identify that 10% who suffer from cetirizine-induced drowsiness, you literally have a captive audience looking for a better quality of life. They want a solution, and you are the exact expert equipped to provide it. Now, what's really interesting about this is how easily you can offer targeted solutions. We aren't just throwing products at the wall to see what sticks. We have a totally categorized response.
First up, we've got the direct pivot, a non-drowsy alternative, something like stepping them over to fexofenadine 120 milligrams. But what if they absolutely insist on sticking with what they know, or they just have this lingering fatigue? Well, we have combo products, pairing an antihistamine with a mild stimulant like caffeine. Or we can even look at the adjacent energy category, recommending B-complex vitamins or ginseng to help combat that lethargy naturally. You're offering a tailored, comprehensive solution right there at the counter. Of course, having the right products behind the counter or on the shelf, that's only half the battle. If you don't know exactly how to present them to the patient, the opportunity just evaporates. The delivery is literally everything. It's all about combining empathy with your clinical authority. We need a reliable patient script to make this transition seamless, making sure the patient feels heard, cared for, and absolutely confident in your recommendation to switch things up.
Okay, here is the exact script. If the cetirizine makes you sleepy during the day, I have a non-drowsy version that works just as well without the fog. It is really that simple. Let's break it down. You acknowledge their struggle, the sleepiness. You offer a direct replacement, a non-drowsy version. You reassure them of the efficacy, that it works just as well. And finally, you highlight the ultimate benefit, without the fog. It's a brilliantly empathetic and highly effective approach to pivoting the patient's routine without totally overwhelming them with complex pharmacological jargon.
Which leaves us with this final, somewhat provocative thought to take back to your practice today. Drowsiness isn't a dead end, it's a switch to a higher margin product. When a patient hits a hurdle with a medication, it absolutely does not mean the interaction is over or that therapy has failed. It's an opening. It is your chance to step up, elevate their care, provide them with a noticeably better quality of life, and simultaneously drive a smarter retail outcome for your pharmacy. So the next time you hear a complaint about daytime fatigue from an allergy sufferer, ask yourself, are you seeing a dead end, or are you seeing the perfect opportunity to switch the track? Think about that as you head into your next shift. Thanks so much for joining me for this explainer, and I'll catch you next time.